Hey, good people. This week we are going to be looking at the topic of boundaries and multiple relationships in the helping profession. And the thing that I want to talk with you about and encourage you to be mindful of is to please pay attention to the case studies that are included in the chapter. Please make sure you take this opportunity to read through those case studies and become familiar with some of the examples that they give you in regards to multiple relationships in the helping profession. Because one of the things that we need to be mindful of as helping professionals is that, yes, while multiple relationships can occur in the helping profession, we as the helping professional must be sure that everything that we do that we maintain our ethical conduct as it is addressed in our code of conduct. Just as in the beginning of the semester, I encouraged you and provided a list of different agencies, organizations, professional organizations, I should say, their websites. And I would encourage you to search their websites for their code of ethics, the code of conduct, in regards to what it may say about the multiple relationships. Some of the things that we have to be mindful of, just as it's listed here on the screen, is we want to make sure that as a helping professional that our judgment and our objectivity is not impaired when we're in these multiple relationships. We want to make sure that our ability to render services effectively and efficiently for our clients, that is not in jeopardy. And also we want to make sure that there is no possibility of exploiting our clients based on their feelings, their wants, their needs, and their position in the helping relationship. Now, when we talk about boundaries in the helping relationship, some of the things that we need to be mindful of, and I skipped forward to this one because I want to touch on some of this stuff, is what we need to consider from a professional's perspective on what this multiple relationship would look like. And so we need to think about, what is my motivation as a helping professional to gain a relationship outside of the helping relationship that I have with my client, consumer, or patient? And how is this consistent or inconsistent with our treatment plan? Also need to be mindful of, very specifically, when we talk about our client's history, their values, their cultural expectations, and also make sure that we're looking at this issue of transference and non-transference and countertransference, so that we don't have this misunderstanding of what the purpose of the relationship is, what the goal or the intent of the relationship. With that being said, we have to make sure that we are always mindful of our client's safety, making sure that everything that we do and that we say in a helping relationship is one that is going to be ethically beneficial for our client, consumer, or patient. When we are in the process, or in this space, I should say, of the challenge of looking at multiple relationships or boundaries in our relationships, sometimes we do have to get into a position where we may need to seek some consultation with our colleagues or with a supervisor in regards to what may be happening in our working relationships with our clients, consumers, or patients. And please know this, good people, that seeking consultation from one professional to another, as long as you are maintaining that confidentiality, it is definitely something that is okay to do. Okay, now when we get into this issue of talking about boundaries, we have to have an understanding of the differences when we're talking about boundary crossings versus boundary violations. Boundary violations is a very, very serious breach of the relationship, somewhat of an unethical relationship, when we begin to see some unethical practices from the worker onto the client, where it could prove to be detrimental in the client, consumer, patient, in their well-being, whether it be their physical, mental, their emotional well-being. Boundary crossing is something that it does take place a lot, and this is with that transference and that countertransference, when we see helping professionals that may cross the boundary a little bit when we start looking at self-disclosure. Now, sometimes it is helpful and beneficial for some clients, consumers, and patients to hear a helper's perspective on things, how they may have addressed an issue that may be similar to what they're going through. But when the counseling session becomes uh, the large part of it overwhelmingly in favor of the helper talking about their situation, then the client begins to get this perspective that, well, wait a minute, am I here for me or am I here for you? And is my issue the one that's being addressed, or is it more important that you're talking about yourself? You meaning the counselor. So we have to be very careful with that boundary crossing, that we don't self disclose too much, that we don't cross the line too much. Yes, it is very good and it is okay to be supportive of clients, consumers, and patients in some of the things that they may be doing, but we must be mindful of when to cut things off so that it doesn't, again, begin to inappropriately impact the client, consumer, patient in what they may be doing and reaching their goals. So when we talk about multiple relationships and boundaries, there's a lot of information in your textbook about home-based therapy, cultural issues, um, role blending, definitely things that we need to be mindful of. So please make sure you don't skip over that part in your textbook. Make sure that you read that information. When we talk about minimizing the risks in multiple relationships, again, this is where some of this is established when we talk about that informed consent in the very beginning of our counseling relationship, where we set the clear boundaries from the beginning. This is what I do, who I am, this is who you are, and what you're bringing. If we get to the place where we begin to see the relationship going more towards a friendship or something different, this is where we may again need to seek that consultation with our colleagues or supervision. One of the ways we definitely make sure that we minimize the risks of multiple relationships and that we adhere ethically to working for the benefit of our client, consumer, or patient is definitely document, document, document. Documentation is your friend. If you keep good case notes, that kind of helps you to maintain the progress of what's going on for the client, consumer, or patient, and it helps you to maintain your integrity. Also, when we're talking about looking at that multiple relationships, what's your motivation as the worker? Why are you trying to, or what, how's it going to benefit you, I should say, in creating or developing a relationship outside of the helping professional? If things get to be too hard for you and get to be too confusing in regards to your relationship and your position and your role as a helping professional, just know this, good people, that it is definitely okay to refer a client to a different worker in order for them to be successful in reaching their goals. Now, when we talk about looking at multiple relationships, excuse me, and looking at our boundaries, some of the things that come into mind is, and especially we can see this in this area, is working as a helping professional in a small community. There are definitely some uh, hurdles, some challenges. Um, yeah, some different things that we have to look at and be mindful of as we're working with customers, consumers, clients, patients in a small community. Some of the things we have to be concerned about would be definitely confidentiality. We have to be mindful of how we obtain information from our clients and where we maintain or how we house that information for our clients. We want to make sure that when we're talking about boundaries, especially when working in a small community, that we are very specific in paying attention to how well we set those boundaries from the beginning. Not saying that we have to um, truly alienate ourselves from our community or from the client, but we do have to make sure that we have an understanding about how we're going to address, again, our expectations, our roles while we're in this helping relationship. Some of the things that we have to pay attention to when we talk about working in small communities and maintaining confidentiality is we have to know that, of course, we meaning the helping professional, may have an opportunity that we run into our clients, consumers, patients while we're out and about in the community. And that's something that's okay, that it's expected to happen. The question then comes into play: how do you respond to this? And this is something that you, the worker, have to determine within yourself of what your comfort level is, and also preparing the client, consumer, patient of how you are going to address this issue. For me, myself, working in a small community, even as a professor at the community college, if I see a familiar student out in the community, I will not engage that student initially. I will allow that student to have the opportunity to engage me first, and then I'll go ahead and follow through based on what their level of interaction may be. If it's just a wave to me, then they'll get a wave back. If it's a conversation, then we'll have a conversation. And the reason why I do that, it stems, of course, from my practice, or the way that I conducted myself in direct client care, but also looking at this at the fact that I don't know everyone's history. I don't know what everyone may be doing, or who knows their business, so to say. So I'm not going to put a student in the position of needing to justify how they know me if they're with someone who is not familiar with the journey that they may currently be on. So again, I allow the student to interact with me first, or to initiate the interaction before I initiate it. And that's something that very well may be what you have to do when you're working with your clients, consumers, and patients in a small community. Now, as we move on and talking about these professional relationships, we get to this point of talking about bartering. What is bartering? Bartering basically is looking at an exchange of goods or services in lieu of paying a fee. Now, when we talk about bartering, we have to have a good understanding about, and let me go ahead here. I'm sorry, I think I missed. Oh no, this is the slide I wanted to go to. I'm sorry. When we're talking about bartering, we have to make sure that we have a good understanding from both perspectives, from the client's perspective as well as the helping professional's perspective. What is it actually that is going to be exchanged if it's not going to be a fee for service? Now, when we talk about what's going to be exchanged, oftentimes it's better to exchange goods than it is to exchange any type of service. And our code of ethics, or ethical codes, and several of the helping professionals give specific guidelines when we're talking about bartering. So please make sure you take the opportunity to look at some of those code of ethics from the professional organizations. When we talk about the exchange of goods, we have to have things in writing. Like I said a few slides back, documentation is your friend. Things must be documented in order for folks to be able to function according to what the expectation is. And that there's an understanding of what their role or what their behavior should be. When we talk about establishing a bartering relationship, again, some of the things we have to look at is, first of all, the thought process, or we'll just say this, the thought process of the client, consumer, patient, as well as the intent of the professional. Again, what is your intent here, helping professional? And are we doing anything that could jeopardize the well-being of our client, consumer, or patient? We have to determine the value of the goods or services that we're going to be exchanging, one from another, from the client to the helper, from the helper to the client. There has to be, as I said, there has to be something in writing. There should be documentation. There must also be a specific time period that is spelled out when we're talking about how we are going to be, or the length of time that we're going to be looking at the bartering for services. There must also be, this opportunity where, if questions, concerns come up, that either the helping professional has an opportunity to discuss this with colleagues or supervisor, but also that your client, functioning under, again, that whole concept of the informed consent, that they also have that opportunity to consult with someone else. Now, we need to be mindful that bartering and gift giving, that is two different things. Gift giving, we have to be very careful with, good people, when we're talking about how we determine whether we're going to accept a gift from a client, consumer, or patient. One of the things that I always stood on, And this was when I was, again, working with direct client care in many of the agencies that I worked with. One of the things that I stood on was just straight across, I'm sorry, I can't receive this because it's against agency policy. It's against hospital policy. Because a lot of people just want to say thank you to you. And a lot of folks just want to say, I just want to give you something. And sometimes that's okay. But again, we have to think about what is the intent behind the gift? What is the motivation of this client, consumer, patient for me to accept the gift? Is this gift of a significant monetary value? Is this gift something that if I reject it, that it could be offensive to the client, consumer, or patient? This very last bullet that we see down here, the cultural implications of accepting a gift. I'm sorry, I moved ahead. When we talk about the cultural implications of accepting a gift, we know that some cultures look at um, gift giving as this is my payment for services. So again, if that's the motivation for the client, consumer, patient, even if they have insurance coverage to cover your services, even if they're paying out of pocket, culturally, they may still feel obligated to give you a gift, to pay with a gift. These are things that we have to become familiar with um, when we're working in culturally diverse populations. So again, when we're talking about receiving gifts, we really got to be mindful of what is the intent behind the gift. As the helping professional, there's really not a lot of gifts that you, the helping professional, should be giving to a client. Your gift giving should be limited to basically just information and resource and referral. So I don't know if you really could call that a gift, but there really should be very little gift giving coming from you, the worker, to the client. Now, when we talk about social relationships with our helping or with our clients, consumers, and patients, we have to know that, yeah, there are some disadvantages that come along with the having that multiple relationship. And the biggest disadvantage to me is that this client now sees you um, in a different perspective, that you are more than just their therapist, but now you are their friend. And in becoming their friend, at some point in the future, they may double back and say, but I need you as a therapist again. So you create this confusion, this role confusion. What is the expected behavior of you, the therapist, functioning as their therapist versus functioning as their friend? So we got to be careful with how we are carrying ourselves. And if we want to take that challenge of establishing social relationships with our clients, consumers, and patients. It's not our goal in the helping profession to get our needs met as helping professionals by establishing what we think are friendships with our clients, consumers, or patients. That's not our goal. Our goal is to see our clients, consumers, patients through to reaching their goal. And it is important for us to be mindful as helping professionals that friendship is truly not an option in the helping profession. Um, and if you feel like you are forming a friendship that could possibly lead to something beyond that, then that's when it's time to examine your intent as a helping professional. That's when we get into this whole idea here, or this topic here of sexual attraction in the helping profession. Um, this is something that, again, each helping professional must be attuned for themselves of how they are viewing their clients, consumers, and patients. It's not a crime, and it's not a breach of an ethical conduct to find someone to say that, oh, they look handsome, or she looks beautiful, to identify that, okay, yeah, you look good. But when we get to the place that we start saying, wow, yeah, they really look good, or we start seeing them in a sexually attractive way and not seeing them as a client, consumer, patient, then this is where we begin to experience some problems as a helping professional. There, again, We can see them as being attractive. You're a nice looking man, you're a nice looking woman. But when we start to see them sexually as sexually attractive, then that's when we have a problem. When we are talking about the sexual attraction of our clients, consumers, and patients, these are some of the things that we have to look at when we talk about minimizing that sexual attraction. When we talk about minimizing the sexual attraction, we're looking at definitely how am I, the worker, first of all, presenting myself to this client, consumer, patient. What does my costume look like? Again, your clothing has a lot to do with how you present yourself as a helping professional. If we are at this place where we're seeing our clients in a sexual way, we again have to recognize the difference between sexual attraction and how we are responding to this attraction. We want to make sure that we have our boundaries very clear in the beginning, especially if it looks like we're getting to the place where the client is beginning to make sexual attractions or sexual advancements towards us. If we, the helping professional, feel as though that this is an ongoing challenge, then we need to get some type of consultation, either with a colleague or with a supervisor. We want to make sure that every interaction that we have with our client, consumer, patient is in an open environment, whether it be in an open office setting, whether it be in with a colleague present or with a supervisor present, whether it be in a location where it's not too private, meaning that when you're in your office, you do not shut your office door. The office door stays open. We also have to be mindful, good people, of the issue of touch when we're talking about dealing with sexual attraction. Now, a lot of us may have this feeling to hug. Like for me, I'm a hugger. So if I see a good friend that is having a bad day, or maybe a good friend that is maybe they're crying, okay, I'm a hugger. I go out, I go in for the hug. Um, but with a client, consumer, or patient, I can't always go in with a hug. If you see someone that's struggling, um, just the touch itself could mean something different to them. So if you're like me, a hugger, then you have to learn how to monitor your touch. The touch can be a touch of, I hear you, like if you're just touching the arm, I hear you. But if you begin the stroking or the rubbing on the arm or the rubbing on the leg, then that's when you get into some issues of there's some confusion in the touch that's being given and the touch that's being received. So I hope that makes good sense, guys. When we're talking about dealing with sexual attraction, again, we just want to make sure that if things get to the place where we know feelings are brewing and they're coming to the surface, then that's when it's time for you, the worker, to terminate that relationship and refer the client, consumer, or patient to another worker that would be able to assist them in reaching their goals. When we talk about clients who have been victims of sexual misconduct from a helping professional, there are a lot of consequences that come along with that, good people. We have to be familiar with what these consequences are, because these consequences lead to a client beginning to look at themselves very differently and begins looking at themselves in a very negative way, which could lead to additional emotional instability. It could lead to additional feelings of rejection, and possibly to suicidal ideations. These are things that we as the helping professional, we must be mindful of. So again, when we're talking about this whole idea of um, boundaries and relationships, we as the helping professional, we have to be the ones to be in charge of, or be the ones who are um, working to maintain that healthy helping relationship. Okay, so it's not going to be this issue of, oh, I don't want you as a friend, but it's going to be this issue for me, the worker, to maintain a healthy helping relationship. So in this chapter, again, we're looking at the whole concept of maintaining healthy boundaries and healthy relationships. healthy working relationships with our clients, consumers, or patients. Okay, so this week, again, there are case studies in this chapter. Please, good people, don't overlook those case studies. It's very good information, and it helps you, again, to begin to think about some of the information that you may have read in the chapter and to begin to apply some of that information also in your thought process of how you would deal with a client in this type of situation. There are also, or I should say, there is also a discussion post for you for this chapter, as well as an assignment in the chapter folder. All right, good people. So I hope you have a good understanding after you've read through this chapter relating to boundaries and relationships. And if you have any questions, comments, or concerns, please feel free to contact me by email or message me through Schoology. Love, peace, and bacon grease. We'll catch you on the flip side.